Before we begin, let's make sure we have everything we need for your injection. Start by washing your hands thoroughly with soap and water or with hand sanitizer rub. Clean hands are essential to prevent infection. Now that you have clean hands, we're ready to prepare the medication for injection. NAD Plus is a peptide that requires reconstitution, so from our pharmacy you will receive Bacteriostatic Water in a vial, as well as the vial of your peptide with the medication in it. It is in a powder form in the vial you see here. You will also receive a syringe and some alcohol swabs. The syringe has a needle attached. First, you'll start by uncapping both the Bacteriostatic Water and the NAD Plus vial and swab both with the alcohol swab. This prevents any contamination of the vials. Next, you will take your syringe with the needle, draw back about 10 milliliters of air because the Bacteriostatic Water has a vacuum. This will allow you to draw back the 10 milliliters of water into the vial. You may need to press the air into the vial a couple of times to ensure you get the right volume. I like to draw back just a little bit extra of the Bacteriostatic Water. That way I can account for any air. You can tap the side to get the air to the top and then push out any extra by pushing on the plunger. Now that you have your 10 milliliters, you're ready to inject into your vial of medication. Carefully place the needle into the top of the vial. It is also vacuum sealed, so it will automatically pull in that water and then remove that needle. You can safely recap that needle by using your hands or placing it down on a clean surface and recapping. Then invert the medication vial to make sure it is thoroughly mixed. Now you're ready to inject. Insert the needle into the vial and pull back on the syringe plunger to draw the prescribed dose into the syringe. Be careful to draw slightly more than needed to account for any air bubbles. If you notice any air bubbles in the syringe, gently tap the side of the syringe to bring them to the top. Then push the plunger to expel any air. Ensure you have the exact dosage remaining in your syringe. Subcutaneous injections are typically administered into the fatty tissue just beneath the skin. Common sites include the abdomen at least 2 inches from the belly button, the thigh, the back of the upper arm, or the hip area. Today we'll demonstrate injection in the abdomen, which is a popular and accessible site. After selecting your injection site, disinfect the area with an alcohol swab and allow it to dry. Gently pinch the skin around the injection site to lift the tissue. Insert the needle at a 90-degree angle to the skin and slowly push the plunger to inject the peptide. Take your time to ensure the medication is delivered smoothly and fully. Once the injection is complete, remove the needle at the same angle it was inserted, apply gentle pressure with gauze, and if necessary, you can cover the site with a bandage. Dispose of the used needle and syringe immediately in a sharps container to maintain safety. It's normal to experience mild discomfort or a little bit of redness at the injection site, but this should go away quickly. If you notice any significant swelling, redness, pain, or if you experience unusual symptoms, contact your healthcare provider right away.